Well, in a society that's searching for the fountain of youth, cosmetic procedures like Botox and plastic surgery aren't uncommon procedures for women in their 20s and 30s. But you might be surprised to learn that more and more teenagers are going under the knife and that a leading plastic surgeon is advocating procedures for some teens. Here to explain the pros and cons of plastic surgery for teenagers is Dr. Frederick Lukash and Dr. Matarasso. And we want to warn folks before we get into this story that there is some video that could be a little bit disturbing. If you're squeamish and like me, you don't really like to see the surgery. But doctors, thank you very much and welcome to you both.
Thank you.
Thank you.
And Dr. Lukash, I want to start with you because you've got a book on this and give you a chance to explain. You're not saying every teenager needs to run out and have plastic surgery, but you do think it's right for some of them.
Yeah, I hardly think it's for everyone. As a matter of fact, it's for the very few, those that have a certain structural problem and a psychological angst that relates to the structural problem that they have. It is clearly not a panacea for adolescent or teenage angst. It's one spoke on the wheel of self-esteem, and it's designed for those only who have been vetted, so to speak, those that will benefit from it and will psychologically adjust to it.
And Dr. Matarasso, I got to ask you, you've probably turned patients away who are this young. Tell me why you think this isn't right for people who maybe physically and mentally aren't done growing up just yet.
Well, as Rick has pointed out, there's a certain level of physical and emotional maturity that has to come with these procedures. These procedures are irreversible, they're lifelong, and they need to be done for the right reasons. 90% of teenagers will report something that they don't like. And it's long been a slippery slope for parents to walk that fine line between helping their child grow up and overemphasizing physical appearance. So part of what we do is recognizing that as plastic surgeons and determining who will benefit and who won't.
And Dr. Lukash, let me ask you, a lot of teenagers, we all went through phases where we did not like the way that we looked. There were things that we hated and wanted to change. How do you separate that from somebody who truly has a need that needs to be met with plastic surgery?
Well, that's the skill of the physician, being a physician, and not just being a beautician. The whole goal is not to trivialize plastic surgery, but to remember that we're physicians first. We're going to evaluate the individual. We really are not, or should not be, procedure-oriented, but rather problem solvers. So we need to look at the individual, counsel them, counsel their family, and to see if it would be a possible fit. There are certain structural issues that can lead up to a tremendous amount of psychological angst. A young child whose ears stick way out is called Dumbo every day. There's nothing that's going to change that. Now, if they're not bothered by it, we're not interested in fixing it. But if they are bothered by it, and there's a tremendous psychological angst from it, then there's a solution that we can offer. If there's a boy who's got feminized breasts and won't take his shirt off, won't go to camp, won't go to the beach, there's no psychology in the world that's going to make him feel better about himself, but there is the possibility of a surgical correction.
And Dr. Matarasso, I want to give you a chance to respond here. What would be the red flag for you that would make you turn away a young patient?
Well, they have to have that emotional maturity. They have to be inspired by their own needs. You can have a tremendous impact on somebody. This is an indelible period of their lives. However, if the child is coming in because their parents want it or they think it's for social acceptance, they're not going to be good candidates. This is something that they have to live with. They have to have the right motivations, and it can be a lifesaver in the appropriate situations.
All right. Doctors Lukash and Matarasso, thank you both for your time. A very interesting topic.
Thank you.